Hi, in this video I'll be explaining what is intermittent fasting, what are the common methods of intermittent fasting and why one should do intermittent fasting, what are the health benefits and who should not be doing intermittent fasting. So let's get started. IF, as the name suggests, you need to fast between meals intermittently. Intermittent fasting is not a diet, that is, it does not specify what to eat and not to eat. Rather, it is a pattern of eating and not eating. Although IF has been trending in recent years, it has been practiced since many years by different religions for cleansing of mind and body. Now, these are the common methods of intermittent fasting. The 16-8 method, fasting for 16 hours and eating within the 8-hour window. Now, you can choose your eating and fasting window period. That's completely upon you. Generally, this means skipping your breakfast, but some people prefer to skip dinner instead. Now, the next method is the 24 method, that is fasting for 20 hours and eating within 4-hour eating window. Now, generally this would mean eating one meal a day. Lots of people find the 16-8 method to be the simplest, most sustainable and easiest to stick to. It's also the most popular. Although IF does not specify what to eat and not to eat, but my advice is to eat clean and healthy foods in all your meals, and also you can add more fats into your meals so that it becomes much easier to go from one meal to another meal. IF works because of these two powerful hormones, insulin and human growth hormones. Now, these two hormones have an inverse relationship, that is, during IF your insulin levels will go down and your HGH will go up. How does IF lowers insulin? For that, let's first understand how insulin works in the body. So whenever you eat something, mainly carbohydrates, your blood sugar rises. Your normal blood sugar level is 100 mg per deciliter. So now, to regulate this extra sugar, your pancreas secretes out insulin in your body to regulate that extra sugar, and it brings down the sugar level. And how does it brings down the sugar level? It first sends into your liver glycogen, then into your muscle glycogen, and then it gets converted into fat. Now, why was this graph important to explain? Because someone who is trying to lose weight or someone who is trying to lower their blood sugar levels, they already have high amounts of insulin in their body. This is because the insulin is not able to deliver the extra glucose into the cells of the body because their glycogen stores are already full. So what it is doing is it is converting that extra sugar into your fats. So this is also called as insulin resistant. Now, whenever you eat something, your body makes insulin, but your cells are resisting that insulin, and all that extra sugar glucose is getting converted into fat, and you again feel hungry and tired. So this whole cycle continues and is known as insulin resistant. Now, when doing intermittent fasting, your insulin sensitivity improves, your insulin levels drops down, which makes the stored body fat more accessible for energy, and you get the benefit of losing weight, your sugar levels go down. Also, your human growth hormone increases as much as 5-folds. This explains that you do not lose your muscles even during fasting. In fact, it increases your muscles, and in turn which will help in your fat loss goals, because the more muscles you have in your body, the more fat burning, because muscles are metabolically active tissue. Now let's see what are the health benefits of IF. Firstly, it will help you in losing weight, fat. Second, it will help in lowering your insulin and blood sugar levels as you cut down on the frequency of your meals, your insulin and blood sugar levels will come down. It will reduce the risk of type 2 diabetes, increase in HGH, that is human growth hormones. Your overall lipid profile will improve, that is your triglycerides levels will come down, and your good cholesterol, that is HDL, will go up. Remember, total cholesterol number doesn't tell much about the overall health of the person. It will help in mental clarity and brain health. It may also protect against Alzheimer's disease. It will give you an increased energy level. There also health benefit of reduction in inflammation, and also it can give you possibly a longer life. Now, who should not be doing IF? Pregnant women should not be doing IF. If you are breastfeeding your child, you should not be doing IF, as the infant is taking a lot of nutrients from the mother, and we do not want to deprive mother of any nutrients. Babies, small children, underweight, thin people, and someone who has an eating disorders like anorexia. It is characterized by low weight and fear of gaining weight. Many people with anorexia see themselves as overweight even though they are in fact underweight. So these are the people who should not be doing IF. So that is all about intermittent fasting. I'll be making another video where I'll be explaining what are the acceptable liquids you can have during intermittent fasting. Till then, if you have liked my video, please give it a thumbs up, share it with others, and do subscribe to my channel for more evidence-based videos on health, fitness and nutrition. Thank you.